If it's suspected that you or a loved one with a neurodevelopmental disorder are experiencing mental health challenges, reaching out for support is the best course of action. Sometimes it can be very challenging for an individual with NDD to recognize their own mental health problems and to articulate these thoughts and feelings to someone else. When this is the case, parents or caregivers may be the ones who notice that something's going on. They may observe a change in their loved one's mood or behavior. For example, a mother might notice that her child is becoming more irritable, angry, or withdrawn. Or a partner might notice changes in his wife's behavior, like his wife not going to work or no longer enjoying what she used to. So getting help is essential at critical times like this. But there are several barriers to accessing mental health services that are somewhat unique to NDD. These barriers include limited community resources that understand both NDD and mental health, a lack of funding, and service providers who lack the training, experience, and confidence to work with NDDs. What makes it worse is that the way that services are delivered to individuals with NDDs and mental health problems are largely fragmented in North America. On one hand, the NDD-specific services tend to focus on the development of independent living skills, social skills, and occupational functioning. And there's a teaching and rehabilitation approach to these programs. On the other hand, mental health problems are usually addressed through the mental health system, and this system tends to focus on reducing symptoms and promoting recovery of mental health ailments. Because these two systems tend to operate independently from one another and have minimal integration with each other, individuals can receive inadequate care and even fall through the cracks altogether. There are some programs that do integrate the two streams of treatment, but these programs tend to be more tailored to child populations or have specific parameters around which they offer care. For example, NDD programs generally require a person to have significant cognitive and adaptive functioning limitations, which will not be present for all individuals with NDD. So it can really be useful to help individuals and families to advocate for their mental health needs. I'm going to share some possible ideas with you that you might share in your interactions with caregivers, parents, and individuals with NDD themselves. Consider joining NDD-related support and advocacy groups in your local area. These can be a great resource to help locate word-of-mouth referrals from others who've successfully found mental health providers or programs. Since there's no referral needed to see a mental health provider in private practice, you can search for a provider who has the core skills needed to treat the presenting mental health problem, even if they don't have expertise in NDD per se. For example, cognitive behavioral therapy is a well-established and evidence-based treatment for anxiety and depression. So if these are your reasons for seeking out mental health support, look for a mental health provider who offers this form of treatment. It can be difficult or a sensitive decision, but disclosing your NDD diagnosis during the intake meeting with a mental health provider can be helpful in determining whether the provider can meet your needs. Emphasize that the reason for your treatment is not necessarily for the NDD itself, but for your specific mental health problems. Parents and/or caregivers may be absolutely essential in seeking and obtaining mental health services for their child struggling with NDD and mental health challenges. However, sometimes even adults who are capable of seeking their own mental health treatment wish to involve a supportive family member in the process. If the involvement of a parent, caregiver, or family member is important to you, ask for this to be part of your mental health care. Raising a child with NDD can be an overwhelming and stressful experience for parents and caregivers. Therefore, it's important to consider the mental health of the broader family system. It may be helpful to offer referrals for parents or caregivers who may themselves be struggling with their own mental health challenges and/or the stresses of caring for a loved one with NDD. With adequate support at the right time, you can dramatically impact the course of mental health problems. The benefits of early intervention for mental health problems can lead to reduced distress, reduction in the progress or seriousness of mental health problems, and contribute to better overall mental health outcomes.